Okay, so a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers by retired teachers. We've also expanded our offering to include similar groups. So maybe you have some friends that are nurses, doctors, accountants. They're also able to join ARTA under our public-private sector. However, this group would fall under our education sector, and your staff members would also fall under our education sector. We've been the sponsor of our group benefits plan since 1995. We have over 30,000 members, and we cover over 41,000 lives. Our provincial office is located in Edmonton, so we're just sort of on the northwest part of the Edmonton city. However, we've also just recently opened up a satellite office in Calgary for our members who do live in Calgary. So if you or any of your staff members want to come in and do an in-person face-to-face meeting with one of our member services team members, they're certainly invited to come to one of our offices. However, we also do virtual appointments, so you can visit arta.net and schedule a virtual appointment with one of our member services team members. So there is a fee to becoming an ARTA member. In our education sector, if you're a regular education sector member, which I'll talk about a little bit later, it's $25 a year, and that's $2.07 added onto any monthly premiums if you're taking part in a benefits plan. And our affiliate education sector, so affiliate education sector members are those education employees who haven't contributed to an ATRF pension plan. It's $50 a year. But with your ARTA membership, not only are you gaining access to some of the best benefit plans there are in the marketplace, you're also able to take part in some of our really great membership advantages. We have various wellness initiatives that we host throughout the year for our members. We have a photo contest, a physical wellness challenge, as well as a writing contest for our members. So this is ARTA's way to support our seniors in living an active and engaged lifestyle. We also have a really great discount program. We recently brought our discount program in-house. We have contacted, many businesses to offer discounts to our members, and on screen here is just a few partners that we have that offer discounts to our members. So different restaurants, hotels, retail outlets, different attractions there are throughout Canada. We have discounts too. So if you use your ARTA membership discount card, once or twice, your membership will have paid for itself. We also have a really great scholarship program. So ARTA offers 8 scholarships, $5,000 each, to our scholarship recipients. So our members' children, our members' direct relatives, are able to submit their application to our scholarship program. So any of our members' direct relatives, like children, grandchildren, nieces, or nephews, they can submit their application to our scholarship program and possibly be the recipient of one of our $5,000 scholarships. We also have a really great program called ARTA 101. So this ARTA 101 program is for active teachers, and we have 2 scholarships within our ARTA 101 program. One for active teachers who are currently, maybe getting their master's or getting their PhD, doing some continuing education. Also for our ARTA 101's direct relatives. So maybe there's some teachers whose kids are going into post-secondary education. We have a scholarship available for them as well. We also advocate on behalf of our members. So, there's different provincial and national interests that occur that we advocate on behalf of our members. Currently, we have the pharmacare program that we're advocating on behalf of our members, but we also advocate on curriculum, different events that are happening within the government. We are nonpartisan, but we ensure that our members have the right tools and education to advocate on behalf of each other. So now I'm going to dive right into the benefit plans. So our benefit plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retiree's lifestyle. We all know retired teachers love to travel. They're no longer bounded by the school year. They can travel to those places that they've been teaching about. And they don't have to go during those high times. They can kind of take advantage of some cheaper holidays. We're also a not-for-profit organization, so any dollar that comes into ARTA goes back to administrating the plan, back to paying out any claims. There's different plans out there that will offer retirees a discount. We don't offer a discount because we don't have any of those profit margins built into our plans. And because we know that our retirees love to travel, we have some extremely unique travel coverage. Our emergency travel coverage does not include any stability clauses for pre-existing conditions, which I'll talk about a little bit later. So there are some eligibility requirements that you must meet before becoming an ARTA member and joining in on one of our benefit plans. So for our regular education sector, you must be a teacher who has contributed to the ATRF for at least 5 years. And those individuals can join our regular education sector. But we do know that, some support staff in schools aren't contributing to the ATRF. Perhaps you're contributing to LAPP. Then you can join as an affiliate education sector member. So you must be an ARTA member, so you have to pay that $25 or $50 a year membership fee. There's no age restrictions to joining ARTA. You can join ARTA at any age, and you're also able to stay on ARTA at any age. We do not have any termination ages built into our plans, including emergency travel coverage. You must be a Canadian resident covered by your provincial or territorial health insurance within your province of residence. We have members throughout the country, so we have a lot of members who retire in Alberta. However, they want to move to BC, or maybe they've got some family on the East Coast. They can move there. However, the only Canadian province where ARTA benefits do not move to is Quebec, because their provincial health insurance plan does not work in tandem with the ARTA benefit plans. Eligible dependents can also join ARTA. As well as any surviving spouse. So if you or maybe one of your staff members, that they're eligible to join ARTA today, and if something were to happen to them, their surviving spouse can join ARTA. And if someone does join ARTA as the primary card holder and they do have a spouse dependent on their plan, that spouse can continue on with their ARTA benefits plan. We do not terminate a surviving spouse. So applying to ARTA is easy. I typically suggest to people that when they know that they're retiring with their school board, you're going to be losing your school benefits. I typically say, look into ARTA benefits, and once you do choose ARTA benefits, apply within 4 to 6 weeks before you lose your employer-sponsored benefits. Sometimes it's a really good, spring break task to look at. But it is really important to apply within 60 days of losing your employer-sponsored benefits, because if you wait for 60 days to pass once you lose your employer-sponsored benefits, you have to fill out a medical questionnaire, which is administered by our emergency travel insurance partner, Beneva. And so depending on your or your staff's health, they may not be accepted to that emergency travel coverage plan. So just get it in early, it's easy. Or we have a lot of people who don't retire at the same time as their spouse. And if they are able to join their spouse's plan as a dependent, that's great. You can have their employer help pay for your benefits. But once your spouse loses their group benefits coverage, just make sure you get that application in within 60 days of losing your or your spouse's group benefits coverage. And your ARTA benefits coverage is effective on the first day following your termination of your group coverage. We do not have any waiting periods. We want our members to be able to be covered when they need to be covered. So I typically suggest get it in early. It's an easy thing to check off the long list of things to do before you retire. So now I'm going to talk about the different plan options that we have available for our members. So we have two sort of umbrellas for our members. We have our comprehensive plans, And our comprehensive plans include a little bit of everything. They have some higher prescription drug maximums, emergency travel coverage, and extended health care. We introduced these under age 65 plans about 2 years ago because we know not everyone retires at the age of 65. Because when you do turn 65, you're eligible for the Alberta Coverage for Seniors plan. And that Alberta Coverage for Seniors plan becomes the first payer in prescription drugs, and then ARTA becomes the second payer. So in our comprehensive plans, these plans do have some higher prescription drug maximums. And our build your own plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. However, you don't have to be 65 and over to join these build your own plans. You can be any age. And these build your own plans sort of allow for some customization on what the person or member might want. First, I'm going to go through our comprehensive plans. So again, our comprehensive plans are available for members who are under the age of 65. We have 3 different levels of coverage within our comprehensive plans, core health being the most basic, and then enhanced health being, has the higher maximum, so the kind of the higher option. And essential health is sort of the middle of the road. All of our plans, whether it be comprehensive plans or build your own plans, all include single, couple, or family care coverage. And each annual maximum is per covered person. So you and your spouse would receive the annual maximum listed for the extended healthcare benefits. So all of our plans include coverage for many, many different things, but we would be here forever if I went through our entire benefits plan. So I just wanted to highlight a couple items, sort of the most popular items that people use, but just know that our plans cover a long list of medical aids and supplies that you might need, CPAP machines, vision, hearing aids. But I'm just going to go through some of the more popular items that people look at when comparing benefit plans. So the overall coverage level within our comprehensive plans is 100% unless otherwise indicated. So overall coverage level means that when you submit a claim, you get paid out at 100%, except for a couple different line items. The overall annual maximum ranges from $10,000 all the way up to $15,000. So that overall annual maximum is what ARTA would pay out every year. So you would have to reach that annual maximum, you'd have to submit a lot of different things to actually meet that maximum. So ARTA under our comprehensive plan covers 80% of prescription drugs, ranging from $1,500 at core health all the way up to $5,000 at enhanced health. You might not know, or your staff might not know how much they've been spending on prescription drugs annually, so they might have a hard time making a decision. What I typically suggest is go to your pharmacist, say, can I get an average of the last 2 years of how much money my prescription drugs have cost me? And then that person can make an educated guess on how much prescription drug maximum that they might need for that year. Paramedical services. So paramedical services are those practitioners that offer massage, chiro, physio, counseling, occupational therapy. ARTA covers a list of 12 different practitioners, but our annual maximum is a little different from other plans. It's a combined annual maximum. So for example, if you were someone who had essential health, you have $1,000 a year to spread out through those practitioners. So maybe you're someone who really likes to get massages. You can use that $1,000 on just massage, but then no, you wouldn't have any maximum left over in that year for chiro, physio, or counseling. We noticed that a lot of people typically only use 1.8 practitioners. So we want our members to be able to use that annual maximum when they do need it on the practitioners that they want. Different plans will give you $500 for massage, $500 for chiro, $500 for occupational therapy, $500 for counseling, but you might not use all of those. So that annual maximum is there for you and our members where and when they need it. Diabetic supplies are a separate line item from prescription drugs in the ARTA Benefits Plan. So we offer our insulin-dependent diabetics $1,750 a year to use on diabetic supplies. Our comprehensive plans also include our 92-day emergency travel coverage, and you're eligible for supplemental travel coverage. And I will go through the emergency travel coverage in a couple slides here. Also, with all of our different benefit plans, you're always able to move up in coverage, but once you've moved up in coverage, you are locked in for 24 months. So our comprehensive plans also include some dental care coverage. All of our plans include 80% coverage for basic, preventative, and minor restorative work. So your cleanings, fillings, polishings, all of your examinations, you're covered at 80%. And in our enhanced health plan, you're also covered for 50% coverage for any major restorative work. So your lovely crowns, implants, onlays, all that lovely dental work. Also, in our enhanced health plan, your eligible dependents are covered for a $2,000 lifetime maximum at 50% for any orthodontic work. So perhaps you have some eligible dependents that are at home that might require some orthodontic work. They have $2,000 to use on orthodontic work. So now I'm going to talk about our build your own plans. So again, our build your own plans were built to work directly in tandem with the Alberta Coverage for Seniors plan. So when people turn 65, they can join this plan. And the Alberta Seniors Drug Plan covers 70% of prescription drugs that are listed on the Alberta Drug Benefits list. And then you're responsible for a co-payment of 30% up to a maximum of $25 out-of-pocket costs. But when you combine the ARTA Benefits Plan with one of our Build Your Own plans, your prescription drugs are covered at 100% if that plan is listed on, if that prescription drug is listed on the Alberta Drug Benefit list. So in our Build Your Own plans, each of the plans require that you choose an annual prescription drug maximum of either $1,200 or $2,000. Sometimes people say, hey, that looks a little bit low. I feel like I'm gonna, need more prescription drug maximum. But if you are 65, you need to remember that the Alberta Seniors Drug Plan is the first payer. ARTA becomes the second payer. So that $1,200 or that $2,000 stretches a really long way. ARTA also covers a long, robust list of prescription drugs that are not listed on the Alberta Drug Benefit list, and we will cover that at 80%. So our Build Your Own plans allow our members to have some customization. We have two plans that do not include emergency travel coverage, HealthWise and HealthWise Plus. And we have two plans that do include our 92-day emergency travel coverage, Total Health and Ultimate Health. And our HealthWise Plus and Ultimate Health plans in the second column, these plans offer some higher maximums on paramedical services, vision care, hearing aids, as well as some defined lifestyle medication coverage. So hair loss, erectile dysfunction, drugs, we cover 50% up to $150 a year. With our Build Your Own plans, again, we cover a long list of different items. So medical aids and supplies, paramedical services are that annual combined maximum, vision care, CPAP machines. So our Build Your Own plans, again, are available for members of any age. And if you do choose a comprehensive plan, ARTA will let you know that, say, happy birthday, you're about to turn 65, please choose one of our Build Your Own plans. And again, with our Build Your Own plans, you're always able to move up in coverage, but once you've moved up in coverage, you are locked in for that 24 months. So all of our benefit plans also include some really great additional resources. We offer a virtual physician service. So if we all know how difficult it can be to find a doctor in Alberta, so we offer a virtual physician service where a member can call a doctor and you can tell them about your symptoms and they can prescribe you medication or let you know what they think your next steps will be. So this is a really great tool for our members because it is so difficult to find care in Alberta, or if you need a physician right away, sometimes we don't want to just sit in a doctor's office when, maybe maybe you have a strep throat or you think you have a UTI. This is a really great place to call and get a prescription made up and not sit in a Medi Center for hours. We also have a really great virtual counseling service. All of our members receive 5 hours of counseling, as well as 5 hours of free couples counseling per year. We also have our ARTA Cares program. So our members can call ARTA Cares. A nurse will pick up the phone and they will help you navigate the healthcare system. We all know how confusing it can be to figure out, what your next steps are to get a second opinion, or maybe you have a family member who is looking, is at a long-term care facility, you're trying to figure out the next steps. You can call ARTA Cares and they can help you navigate the healthcare system. So these are available for our Build Your Own Plan members as well as our Comprehensive Plan members. So now I'm going to talk about our emergency travel coverage. If you're taking part in one of our plans that include emergency travel coverage, so any of our comprehensive plans or our total health or ultimate health plans, you are getting access to some of the best emergency travel coverage there is in the marketplace. ARTA's emergency travel coverage is extremely competitive because we do not have any stability clauses for pre-existing conditions. So if you're somebody who has a pre-existing condition before you're traveling, or maybe you had a change in medication, and you go on your trip and something were to happen because of this change in medication or because of this pre-existing condition, you would be covered for it because we do not have any of those stability clauses. A lot of plans require that you're stable from a pre-existing condition or a change in medication or any type of change in health for 90 to I've even seen 365 days. With ARTA, any emergency medical situation that you have outside of your province of residence needs to be considered sudden and unforeseen. So if there is no cause for concern, go on your trip, enjoy it, and know that if something were to happen, you would be covered for it. We did notice, before, we do notice with some other plans, there are people who don't visit their doctors before they're going away if they are feeling ill. And then they go on their trip, something happens and they're not covered for it. We also have trip cancellation and interruption insurance. So if you do go to your doctor and your doctor says, look, I think you're too ill to travel, I don't think it's a good idea, you can cancel your trip with ARTA because we do have that trip cancellation and interruption insurance. We offer $10,000 per insured person per incident. So just know that, if you fall sick, your travel partner falls sick, maybe your home suffers a flood or a fire and you're unable to go away, just know that you have that cushion with our trip cancellation. And if you do go away and something were to happen to you, you are covered for 100% of eligible expenses up to a $5 million lifetime maximum. That $5 million lifetime maximum is a little bit of a red herring. No one has ever come close to actually meeting that maximum. You're also covered for any 92-day trips you take outside of your province of residence. We know our members, when they're tired, they have all the time in the world. So sometimes they take trips that are longer than 92 days. So we offer supplemental travel coverage in 15-day increments all the way up to 212 days. And any unused supplemental travel coverage 15-day increments that you don't use, you get reimbursed for. However, there is a cost to supplemental travel coverage. So we do have a lot of members who snowbird in places like Palm Springs or Phoenix. And sometimes they find a cheap flight back to their province of residence, hold on to proof that they did cross back in their province of residence, that, maybe a coffee shop or lunch or your boarding ticket. They hop back on a flight back to the sunshine, and that 92 days is an immediate reset. With the ARTA emergency travel coverage, you're not required to be in your province of residence for a certain period of time. Also, again, with our emergency travel coverage, there's no termination ages. So when you or your staff members are looking at different plans, just make sure they're looking at the termination age, because a lot of plans will terminate your emergency travel coverage at 85 years old. So our Build Your Own plans do not include dental care. So ARTA offers 3 standalone dental care options, option A, B, and C. Option A being the most comprehensive and option C being the most basic. So we do offer 80% coverage for basic, preventive, and minor restorative work. Option B offers 80% coverage for minor restorative work. And option A offers 50% coverage for major work, so your crowns, implants, onlays, and all that. You do not need to add dental care when you first join ARTA. You can add it later on down the road. You can add it when you first join. It's entirely up to the member and their situation. All of our plans include single, couple, or family care options. And you're always able to move up in coverage, but once you've moved up in coverage, you are locked in for that 24 months. So we know that choosing a benefits plan can be confusing to people. It can be overwhelming. So we've tried to help our members out on artabenefits.net, and we've created a Build Your Benefits Plan tool. So if you go to this website, or you can direct your staff members to go to this site, you can click on Build Your Benefits Plan tool, and this tool will ask you a series of questions. You're over 65, under 65, whether you want dental, whether you want travel or not. And a chart will populate with all of the different options as well as the monthly premiums. So this is a really great tool to kind of compare different plans, play around with it, see what works best for you and your family. And then you can ultimately apply online at artabenefits.net. So that's all I kind of had for you guys today. I would be happy to send, if anyone, works in an office, or you're the HR person, or you're somebody who your staff members come to and ask for retirement guidance, I'd be happy to send you a chunk of our enrollment kits. And our enrollment kits do include our plan options brochure, which outlines all the different benefits plans that are available. It also includes a rate sheet, as well as some really great information on ARTA and some retirement advice. So if you would like one, or if you would like me to send you a couple of them, or 10, 20, 30, whatever you want, you can email join@arta.net, and I would happy to send them to you, so you can have them on hand if anyone does have any questions about ARTA. But that's all I had for you today. Thank you for joining me this afternoon. I will stick around and answer any questions that anyone might have. If you want to put them in the Q&A function, that would be great, and I can answer anything that does come in. If not, thank you for joining me today. Please watch for I'm going to do a lunch and learn in October as well. So if you have anyone that might be interested in this, tell them to watch their inboxes, and I'll send out a Zoom link for a lunch and learn in probably October or November. There was a question of whether I can send a recording of this. Yes, I can. I will add this to our YouTube channel, and if you visit the ARTA channel, you can always watch this and share this with any staff member as well. I don't see any other questions coming in, but again, I will stick around for a little bit as well and see if anything does come in last minute.